That's kind of comfortable. Just use a book or something.
Baby, baba me. Let me do. Actually, I should have used this one since I can't share from here. Are you welcome to join us on YouTube? You are welcome to join us on YouTube. This is just an announcement that we are live on YouTube. You can join us on YouTube. We are going to do the psycho education program henceforth on the YouTube channel, Apple Worldwide. If you have not subscribed yet, kindly join us on YouTube and subscribe. You can send a comment on the YouTube, so I will know that you are there. I'll appreciate it. We are live on YouTube. You are welcome to join us on YouTube. Psycho Ed episode 6. Anxiety Essential episode 6. We're talking about agoraphobia today. So kindly join us on YouTube, people. Hi, Miss Bowie. Miss Bowie, I know you follow me, you subscribe, and I know I see you on the YouTube channel. So go there. I'm going to end this live. This is just an invitation to whoever is interested to join us on YouTube. Let me know if you're on YouTube. I don't see, and let me know. This came up later as a later plan. Like I would have had it scheduled ahead of time, so by now people will know to be there. So join us on YouTube. I'm not doing the teaching here today. I'm not going to, in fact, be doing the teaching here anymore. I will be doing it on the YouTube channel. Hi, Miss Smith. How are you doing? Yeah, so I'm going to start on YouTube. I'm going to hang out right now. So who is interested in joining? You are free to join. All right. Apple Worldwide is the name of the channel on the YouTube channel. Kindly join us on YouTube. Yes, I see 3 people there. Great. Let me know where you're joining in from. My Apple Worldwide family, my Apple lovers. Yes, let me know where you're joining from so that I can acknowledge your presence. All right. Let me know if you see me okay on YouTube. All right. My Facebook family, this is just an announcement that we are on YouTube, so you are welcome to join us. Adios. I'll see you later. Let me use this to hopefully finish. Share the. Let me try and see if I can get the link and share it to. Yeah, it started, so I don't know why. I want to see if I can anybody share to the page for me? Hi, Miss Mildred. Hi, Miss Johnson. Thank you all for joining. I appreciate you guys. Yes, listening with you from listen to you. Okay, Brooklyn, nice, New York. New York, New York. Nice, nice, nice. I appreciate you both joining. If you any of you can join and share to the page for me, because I don't, for some reason, I don't know whether it's because I'm the host. I don't see it on my end, so I can share to the page, and then we can start. New channel. Okay, this is it.
Was in the middle of filming for True Classic when this happened.
I see it now, so I can share.
This is an extra large t-shirt that I bought. As you can see, it's baggy. Now this t-shirt feels amazing.
Thanks for sharing. If you are on Facebook, thanks for sharing. It's the same. You can, if you are here already, also you can go to Facebook and share, or share from here. You can share the link to others, to people who likely want to join, and then we can start. Okay, we can start. We can start. We can start. We can start. All right. I think I'm done sharing to the page. All right. Thank you guys so very much. Welcome back to Apple Worldwide. Your host, Mamle Yoku Godwins, and I am a psychiatric nurse practitioner, a single mother of two boys, and I am a proud divorcee. As always, we are here to change the narrative about stigmatization, bad mouthing, victim blaming, and parental alienation and mental health as a whole to help enhance healthy lifestyle for each individual, families, and most importantly, children. Thanks for joining today. If you are new to this page, I will encourage you to subscribe, turn on up your notifications so whenever we come live or do any program, you will be one of the first to come in contact with it. One thing that I want to also say is that if you don't follow the Facebook page, kindly do that, because we are more active on Facebook. We are trying to come up here now and be more active with this kind of educational topics. So don't miss out. Join us on Facebook. Join us on Instagram. Instagram is _worldwide. On Facebook, it's the same as over here. On TikTok is _GH. Thank you for joining. I appreciate you guys who are so loyal and come over. Yes, we want to protect the Facebook page, so we want to kind of stay away from. I want to try and position myself here so that I can, or maybe put this up here so I can read from here. You know how we do it. Okay, help me with this charger. I don't want to, so that I'm kind of not looking this way. At least I can look this way a little bit. No, get the charger for me this way. Get it so it's not under the books. Be careful. No, look. So I need it up this way. Okay. You got it? Nothing is sitting on it, right? Thanks for your patience. As I look, put it on top so that it's not the table is not. Yeah. Okay. I'm going to put the computer up here. All right. So today for a while now, we've been dealing with anxiety. If you are on the Facebook page, you know we've dealt with we do a lot of things on Facebook, and we've dealt with bipolar for a while. For the past 6 weeks, we've been dealing with anxiety. And today we are on the type of anxiety attacks or a panic attack that is categorized as what? Agoraphobia. So what is agoraphobia? If I may say, what is agoraphobia? Agoraphobia is a type of anxiety. As you, if you are following me, you know that by now. A type of anxiety disorder in which you fear and avoid places or situations that might cause you panic, right? They make you feel trapped, like you are trapped, like how you are claustrophobic. It makes you feel like you are trapped. You feel helpless and you feel embarrassed. You don't even want people to know. So as a result, you avoid these places, you avoid situations. Even social phobia can also trigger agoraphobia. Okay, and then you get scared of actual or anticipated situations. This don't have to necessarily be real fears, or let's say, oh, if I step to the door, these are unrealistic fears. If I step out of this house right now, I can't breathe, I'll be dying, I'll pass out. Is that a realistic thing? In order for you to step out of the door and out of side of these four walls and something happened to you, it has to be like maybe a heart attack, right? It has to have to be an event that you are not expecting, right? It has to be something. Hi, Miss Paula. Thank you so much for coming, guys. You guys so love me so much. I appreciate it. Hi, Miss Becky. Hi, I see you up there. Hi, Miss Mildred. Hi, Miss Bowie. As for Miss Bowie, I know she's always here. But the new ones that are not here, kindly subscribe to the channel. Miss Reese is here. Miss Reese, I'm so grateful for you for all that you've done for me. And says I'm from Woodbridge, Virginia, not too far from where I am, Maryland. Thank you all so much for joining. I appreciate you guys so much. You don't even know it. Who would have thought that I'll post here and you guys will follow me from Facebook to come here? If you don't love me, you wouldn't do it. So I appreciate you. Okay. And if you can share to anybody who will be interested, and share to your pages, I will appreciate it. Okay. All right. So like I was saying, you step to the front of the door. Is that realistic goal? Is it realistic that something will happen to you and you will pass away? No, it's not. But it's because of the unrealistic fear that if I step in front of this door, something is going to happen to me. That is what triggers them to start hyperventilating, have panic attacks, and have chest tightening, and be hyper have be sweating. How do you call it? Like having sweat, how do you call it, where their whole skin gets wet, their face gets wet irrationally, their palm gets wet, and they feel tense, muscle tension, and all of that. You understand? So normal people don't go through that, but people that have these conditions are the people that endure these situations. Okay, so the fear of actual or anticipated situations. So they assume, and before it could even happen, if it's fact it will happen, they already anticipate it happening. So as a result, they don't even give themselves a chance to see if it's going to happen or not. Hi, John. But they just assume it's going to happen. They anticipate it's going to happen. And voila, it's not happening, but they already start having symptoms of it happening prior to even the said event. You see that? So that is what agoraphobia is. This fear of going out of their closed walls, fear of going to public places, public transportation, being in open spaces or enclosed spaces. Open or enclosed spaces, standing in line, like you see somebody at the train station, or if you're in Africa, you stand in the bus stop, or even here, they stand in the queue. Like, how do you call it? Those people cannot go to, like, Black Friday. If you're in the US, you know what Black Friday is. Or I'm sure UK people too. I mean, other parts of the world too, I believe. They stand in line for a very long time, right? And all of a sudden they start hyperventilating, perspiration going on, and they feel like they're about to choke. Hi, Miss Tanya. Thanks so much. Hi, Miss Janice. Thank you all for joining. Share this video for me. Thank you. So the fear of going out can be anywhere, in closed spaces, like they have in a party in the conference space or something like that, or even open spaces at the parks, bridges. So to me, agoraphobia in a way is like similar to specific phobias. You understand? And the reason why these things are confusing is that they almost have, they naturally have all the same symptoms. The symptoms are the same, but the criteria for diagnosing them is what must be very, very careful in doing. Because how do you know somebody has specific phobia, like fear of bridges, fear of a train, fear of fish, versus they actually have agoraphobia? How do you even determine that? Okay, and that is something that your doctor will work with you. Okay. I'm trying to you see, agoraphobia is what? Is the intense fear, anxiety, and avoidance of a variety of non-specific situations where you escape. You understand? You escape. The escape is difficult, or help might be unavailable. So the difference here is that, with specific phobias, right, you are scared of a specific item. But with agoraphobia, it's a variety of things. You understand? A variety of things, a variety of situations. So the first one is what? Different situations must be. Whereas specific phobia is the intense fear, anxiety, and avoidance of a specific object or situation. You understand? I wanted to strike the difference. So this is one way that your doctor, when I'm teaching about these things on Facebook, I tell you how we providers, we do differential diagnosis, right? We do differential diagnosis. So how would your doctor know, or your psychiatrist, or your psych nurse practitioner, or your clinical psychologist, or your therapist know that the diagnosis you are to be given is agoraphobia, a type of anxiety, versus specific phobia, a different kind of anxiety? You understand? If you don't give details to your symptoms, to the triggers, to things that brings these symptoms on, the doctors won't be able to help you. Helping you start from good assessment and giving you the specific or exact, exact diagnosis. If you have agoraphobia and it's not one item, fear of spaces, fear of objects, fear of coming, open spaces, and you don't talk about it so that the doctor gets to know different things that triggers this anxiety, and the different things that you are scared of, that you have these irrational fears about, and in that irrational anticipation of triggers with, how would they help you? They wouldn't, right? But if you have specific phobia, it's just fear of a bottle, or fear of a coin, fear of, then guess what you do? It's simple. That treating that will be simple because it will be focused, right? You have focused care, focused therapy that address that specific thing. So it's very important that, and kindly don't forget to like this video. I'll appreciate if you do. So you see how it's done. Your detailed information about your experiences, your fears, your symptoms is important. And then understand also, if you've been following me for a while, you know this by now, the duration. The duration comes into play for them to decide which diagnosis should be given to you. Understand? Number one point we are making here today is with specific phobia is goal is one direction, right? With agoraphobia is multiple fears, fear of spaces, fear of places, fear of enclosed spaces, or even open spaces, fear of a crowd, fear of going out to meet people, fear of meeting new people, like a lot. So just let's get that out of the way. What are some of the symptoms that you are probably going to get when you have agoraphobia? Typically, agoraphobia symptoms include what? Fear of leaving your home. That is one big thing I know about agoraphobia. These people can be stuck in their home, in their bedroom, eat their life away. Their whole environment is surrounded with food, junk, trash. They can get out of the house. In some instances they get heavy, they get big, and guess what? Some instances I have come in contact with, they have to take the ambulance to literally break the door and lift them out of their house with the help of men that have power, energy, like strong men, and equipment to lift them out of their home, to go and give them treatment. That's how bad it can get. So if someone have agoraphobia, the earlier you observe it, the better. The earlier now you are knowing it can become a serious problem, you seek help early. You reach out and get help for the family member early. It's very, very important. Okay. Crowds and what? Or waiting in line. We talk about that, like just for no apparent reason. They feel choked. They feel like they are choking. They feel suffocating. They feel like the walls are closing up on them. Their throats get tightened. It's like you are choking. You have, you know how choking is. That choking sensation that, oh, you can't breathe. That's what happens to these people. Okay. Then enclosed spaces. Enclosed spaces is what? Such as movie theaters, elevators, and small stores. So that is what somebody will say, what? Claustrophobia is somebody that is claustrophobic, right? They are scared of, like, you are going to get MRI, you're going to have to lay in that machine for a period of time, 20 minutes to 30 minutes. These people can't tolerate that. You understand? So knowing if you have it, preparing beforehand, psyching yourself, using your deep breathing techniques, being able to prepare ahead of time if this is a diagnostic study that really needs to be done, and you know it ahead of time. Schedule the appointment not too close, go ahead of time so that you anticipate it's going to happen. So you start preparing with your coping mechanism so that you'll be able to psych your mind to say, hey, this is coming up. I need this done. I need this done so they can decide if the size of my my lump or whatever. So I need to avail myself for 20 minutes in this machine. How do I deal with it? How do I cope with it? So you can even do simple practices like locking yourself up in the bathroom a few times and closing your eyes and imagining that you are in the MRI machine, right? And prepare yourself. Hi, Miss Joy. Hi, Miss Caroline. Thank you guys for joining. You understand? So you start psyching yourself, you start preparing yourself towards it before the D-Day comes. And that way you are able to better tolerate it, Using public transportation such as buses, planes, and trains. Yes, people have that. People have that. That can be serious. People, when you are telling somebody you have fears to distance, it seems to be very abnormal for them. But these are realistic fears for the people that experiences it. So this is why I'm teaching this. So you know that whilst you don't have it, people have it and it's real and it's okay for them to have it. What is needed is your understanding that they have it and your ability to provide them support. You understand? They need support. Imagine you meet a stranger in a bus, public transportation, and they having panic attack because of fear of, they probably need AC. They need to sit next to the AC. They need to have somebody fanning them. Are you ready to provide such support to a stranger you don't know? You see how it is? That is what I'm saying. So you knowing what happens with these people, when you see it, you are able to identify, oh, she's probably going through this, or he's probably going through this. Oh, let's call 911. Oh, let him sit in a place where it's airy. That will go a long way than you being the social biases we have, the stigma that we have about mental health that will prevent people to seeking help, or even tell you that, yeah, I know I have panic attack and that's why I'm having these symptoms. I have panic attack in closed spaces and fear of being in the bus and transport. And this is why this is happening. You see, so at least they will be open to you and they will be willing to share with you. And then you knowing now, you can better provide them support. You understand? Help them to take deep breaths. They help them to do some relaxation exercises. Help them to stretch their arms up. Stretch their arms up. And while they do this, almost like they have the the anxiety ball, stress ball in their hands. Let them do that. And even if you are watching me right now, and you are doing this, you see how tension is being released from your arms, and your shoulders. You're just sitting and doing this. That helps a lot. It goes a long way. These situations cause anxiety because you fear you won't be able to escape or find help if you start or feel panicked, or have other disabling or embarrassing symptoms. You see why they have the symptoms? You see why they have these situations? They're scared that this will happen to them in public. They will go and embarrass themselves. And when it does, they won't have help, or somebody will judge them. And this is the whole purpose of Empower White. So you get to know so you don't judge them. You get to know so you provide support when you see somebody in that situation. It could be your friend, it could be your family member, but most importantly, it could even be a stranger who is not comfortable enough to even let you know what they are going through. I have agoraphobia. Yes, we spoke about it, but I know you're working on it. Yes, you see. So Miss Linda is working on her phobia of flight, being on a plane, because she needs to be prepared. So next year, when we are going to have our trip to Ghana, she'll be one of the first to sign up for it. Okay, who else is coming with me? Next year, we're going to have that trip to Ghana. Okay, so I hope you are getting your finances right, so we can all choose a month that is convenient and we request time off from our various jobs. We can go and come. It can be just a 1-week trip, 8 days, 7 nights trip, just to experience nature, the motherland, good food, good people, relaxation encounters, and come back refreshed and have your brain readjusted to the right things, like maybe some biases you may have about Africa, maybe some things you don't understand about Africa. You are going to get exposed to these things and you get to know, oh, it was the TV that was deceiving me, or oh, it was that family member that lied to me. See how it goes. Yes. So thank you for joining once again. So it says what? In addition, fear of anxiety almost always results from what? Exposure to the situation. And Miss Tanya said, super terrible with heights. See, heights that I had to deal with by going on a cable car. Wow. The first time I thought I was going to pass out. See, that is nice that you try to make efforts. You see what I'm saying? So that would be like a specific phobia kind of thing, because it's not different phobias. Miss Linda too is a specific phobia. You see that? So it's not like enclosed spaces or with agoraphobia, it is the fear of just coming out of your home to be exposed to all these different things, brings them anxiety. So as a result, I won't go out at all, because it's not just coming out of the house, it's coming out of the house screaming so loud. I know, right? Yes, yes, but you dealt with it, you faced your fears. Exposure, you did the exposure therapy. Whoever took you through that did good. 2 weeks is good. 2 weeks is good. Nice. Yes, I would love it to be 2 weeks, but some people may say 1 week. I would definitely love it to be even a month. So you see, me, even if nobody is coming, me and Miss Linda, we are going. Just know that. So it will be fun for you to join us. Don't miss out. So next year we are going, and Miss Linda, just like Miss Tanya dealt with her fears of heights. She did that. She got herself to do the exposure therapy on the electric car. Is it electric car, she said, right? Yeah, a cable car. You see, so one thing when you're dealing with anxiety and all these phobias is exposure therapy. That is number one go-to. We have the CBT because you know it's all in your brain. The cognition need to be dealt with. As a result, it affects the behavior change. You understand? Because you have to have someone to psych you and make you realize, like, really, okay, when we are able to get to that door, did anything happen to you? No. So you get to expose yourself. You have to have somebody who is dedicated and have the skill required and needed to help you. Good evening, Mamle. Good evening, Miss Grant. Thank you for joining. Wow, Miss Grant, thanks for coming. Miss Caroline said, fear of earthworms. Oh, snakes. Ooh, not afraid of spiders, mice, roaches. Wow. You see, so she have fear of this, what's the name? Snake-like animals, worms, earthworm, and snakes. That is Miss Caroline. So you see the importance of these things. It's important we get to know. As we are here, everybody is comfortable. They are sharing. So the others know that they are not alone. This is the importance of group therapy. That's why I keep telling you guys, I believe in individual therapy, but I would choose group over anything else. So if you can find yourself in support groups, it's way better than going to pay a therapist every week $100 or $200 and sit down there and she asks you about your week and all of that. Because I've heard that a lot from many clients, that this is all therapists do. That's not how it should be. So find yourself the right, the skilled person. This is why we talked about the scope of chiropractic, the scope of what does it mean for someone to actually acquire or become a chiropractor. And people are, hey, Miss Jai, look at you. Thanks for being here. Oh, you guys are so loyal. I love you guys for your support. You guys are so, I appreciate you guys. Thank you so much for coming. See, everybody, if people think you don't know your loyal fans, I do know them. These are very consistent people, whether Facebook or what. Sometimes they come in my inbox, they send me email. These are people that are very loyal. And you cannot like, that means everything to me. You understand? You really want to. I always tell you guys, it's so great to know who your enemies are. Don't be fooled. It's better you know them, because when you know them, you can eat with them. When the food is here and they are busy eating, you put your hand right where their hand is, because you don't know what they put in front of you. You don't know what they put in front of you, so you're going to put your hand right here where their hand is. You see, so it's always good to be in association and have and how do I put it? And know that you are protected, you are safe, okay? But always leave room. Yes, always leave room to the like the unfortunate, or whatever I would say, unexpected, not unfortunate, unexpected. Okay. Miss Sandra said, anything that claws. she don't do well with anything that claws, you see. So know and understand the differences, and you providing your doctors, your therapists, whatever, with enough information goes a long way. Okay. The fear or anxiety is out of proportion. We know that by now. We know that having anxiety is part of life, right? But when it becomes out of proportion, it is consistent. It becomes debilitating. You were here on Facebook. You are not here. You are not on Facebook. You probably don't know this, but we did it on Facebook. The types of anxiety categories, right? The levels of anxiety. So when it becomes debilitating, it becomes consistent, it affects your day-to-day life and living. My dear, wahala don't start. See the problem. Wahala don't start. Then you may need intense treatment. And at times, you actually need medication. Okay. So you say what? The anxiety is out of proportion to the actual danger or the situation. Sometimes you will stand there. If you don't hear from me what we are doing here, everybody's contributing, everybody's sharing with you willingly now. You are going to see somebody going through that and be like, did I tell you about me? I told you, if you are following me long enough, you know this, that I said in my clinical rotation as a nurse, student, mental health student nurse. Hey, Jehovah. Me, I'm going to, somebody said, hey, in first word, Jehovah. Oh my God, Jehovah God. Yes. I'm going through divorce. I'm being dragged in the court. I abandoned focusing on the court. I'm focusing on the school because I know that is what will bring me to where I am today, that you get to see me, you get to know who Epa is, you get to listen to me. You understand? So I totally ignored the court, abandoned any paperwork that got sent to me, and it beat me bad in my life. Where if you watch the videos on this page, you will know the system is not for you. That's why I came up with the system is not for you. You understand? I will go to school, clinicals, and somebody will come and say that my boyfriend left me, and so I want to kill myself. Somebody will, and now you do investigation, you start talking to them. They don't have a child with this person, no. They haven't bought a house with this person. In fact, they are on welfare benefits, and none of them owe in each other anything. So if he cheat on you, to me, the African mentality was like, so what? I know I don't want to put up with a cheat, right? You guys know me by now. So get to move and keep moving. These people are seriously mentally ill and want to commit suicide. Some have overdosed on drugs so they can take their lives. Some have done, self-mutilation where they cut their skins so they can bleed to death. People want to hang themselves because their partners cheated on them or their partners left them. And I will go to the bathroom. I will be like, are these people okay? What is wrong with them? Shoot. Even me, you have nothing to lose. What about me that I have kids that I'm stuck with them, that I'm like, you have nothing to lose. How about me? I bought a house with this person. You bought a car for this person. You lose all these things, and you are still trying to move on with your life. And these people want to commit suicide, and some have actually mutilated themselves and overdose on drugs. And the disappointment, the one that they don't like, is they said they overdose on drugs and woke up. They woke up to the same living. They thought after overdosing on their drugs, they wake up and they'll be dead and the pain will go away. Jehovah God, oh. I will laugh and laugh and laugh and laugh in that bathroom. That's how biased I was. That is how much I am uninformed. And these are the reasons why. And again, I'm coming from Africa. The resilience, the strength, the nurturing I had probably made me have high tolerance level in terms of, and then different perception. You see the cultural biases and stuff. That's why we have something called culturally sensitive care when it comes to medicine. And that is one reason why I don't trust judges, because I feel like as somebody in those roles, they probably learn about cultural sensitive approach to their judgments and dealing with people. You don't have to judge somebody based on their personality, the way they talk, their tone. If they are not rude in their tone, but they are loud. Some Africans, some of us have loud tones. when we are expressing ourselves or when we feel angry and we feel like we need to defend ourselves, right? So you feel like they should know better, but in most instances, no. So culture comes in a way, it plays a role in these biases. But today, I have learned better. I have understand better. I have understand that these are real fears. These are real conditions that people go through. Many people don't know that these are real. They do just know that, oh, I told you guys, right? My kids, I psyched them to the point where my big son told me, mommy, me, I don't understand why anybody will take medication because they are depressed. Don't they just have to work it out and let them feel fine again? You see, again, that's how he understands based on him being lucky and having a mom like me. However, he is also now understanding that these situations are real that affect people's lives and makes them to not be able to get up and go and come. So guess what? I need to know that it's real for them. Their fears are real. In their mind, it is real. How do they make it unreal? By seeking therapy, by seeking a provider, by talking to somebody. How would they feel comfortable and come to you, my mommy, you, my uncle, me, my father, you, my sister, you, my friend, and say, I've been going through this for a while now. And you know, the lady that shared about her pain after how many years? Is it 13 years or 16 years? She said, right? She still have anxiety and panic attacks and wakes up at, even though she moved on, she got married to a different person. The previous history, the trauma, and all those effects are impacting her life right now terribly. 1 a.m. when you have to be laying next to your partner, you are having panic attacks and somebody else's child has to come and deal with it. Why we have to learn about mental health now? Why we have to learn about these symptoms? Why we have to understand that these are realistic fears, realistic pain, it brings emotional pain, and it causes it makes people to be debilitated whereby they can't function on a day-to-day basis. They can't. They wake up drained. They wake up tired because they go to work and they are tired. Why? Because they stayed up all night long with their symptoms. How would you respond to somebody telling you this? Would you turn them away? Would you like, oh, really? Wow. You see, that facial expression alone gets that person to not feel comfortable to come and tell you again. No. That facial expression alone makes somebody to not feel confident to come and tell you. You understand? To come and say, oh, I'm dealing with this. That's your daughter, that's your son, that is going to come and tell you, Mom, I'm anxious about going to this church. I'm anxious about going to this. Did you take your time to listen to them? Maybe that brother that is leading the church, the youth program, is trying to touch them inappropriately. So they are anxious. They are terrified. They are scared. So when Sunday is coming, they feel terrified. They're already anticipating the things that is going to happen. They're already anticipating how he's going to send them to the office. Oh, take it to the office for me. And then they find wine past that backstage and go and meet them in the office and start touching them inappropriately. Have you paid attention to your child? Have you tried to listen to your child? Some of us, we want the kids to even come and tell us, but they won't. It's not that they don't trust you, but it's because they want to hide things from you based on their backgrounds and stuff. So it's a constant effort to try to talk to them. You know, let's read some of these comments. Miss Maureen, thanks for coming. Miss Tanya said, I know someone who did that after his girlfriend left him. See? And you saw the story I shared to this morning on Facebook with that person that the husband went to have a child, cheated on her, had a child outside of the marriage. She couldn't take it. She said she put on her status, and also, are you paying attention to your friends, their statuses and stuff? Do you reach out to them? Let me tell you a story. I've had an injury at work 2016, I believe. And I took you see blood, the dressing, they put the whole dressing in my left, the front of my issue, my left front of my left leg, full of blood. I sent that picture to my little brother, one mother, one father. He saw it all right. He didn't say nothing. He didn't ask me nothing. But I sent the same picture to some friends of mine. Huh? Are you okay? They call me right away. They text me right away. Are you okay? Is there something I can do for you? But it looked terrifying. So next time, do you think that I'll feel comfortable and send, if I'm going through crisis, I'll send to this specific brother? No, because he will not be the one that will come to my aid in an emergency. That's my one father, one mother, blood related. But she probably didn't even pay attention. She probably saw it as a picture and didn't pay attention to it. Later on, years down the line, I questioned him about it and we spoke about it. But that very moment, that was a serious response. He didn't respond to it. You understand? But I was going to Ghana months later and I sent pictures of shoes that I want to buy for him. And quickly, instantly, he responded. And that triggered the conversation. You understand? So we have to also be a little empathetic to find out how our family members and our siblings and our friends are doing. It shouldn't always be about us and what we can gain, what we can get out of a relationship or out of an encounter. It shouldn't always be about us. Relationships are meant to be bilateral. I always talk about that. It shouldn't be unilateral. If you are with a friend and the friend constantly want to only be associated with you when they need something, my dear, in the 21st century that we are in, you should have an expectation in a relationship. If that's your friend that you care about, that you relate, you go out together, you do things together, it should always not be about them only. It should be both sides, give and take. That is the only way that the relationship will grow. I'm sick, you checked on me. You are sick, I checked on you. That is the life we are living. What else? You see, so let's be each other's keeper and let's not be Mamle in her first psych rotation going to hide in the bathroom and laughing her throat out, laughing at patients and say that, what does she have to lose? You don't have a child with them. You didn't build a new life with them. How long have you been dating them? 1 month. Meaning emotionally you are not self-reliant. Emotionally you lacked love. You lacked love. You were not you lacked love. So you don't know what even true love is. To be able to love somebody just within 1 month and they are going and want to take your life. My dear, is it worth it? It's not worth it. And you that you are listening to this person, do you understand it enough to want to, so how can I help you get out of this situation? What are some coping skills I can arm you with? Do you have transportation to the doctors? If it's your friend, if it's your family member, do you want me to call the doctor for you? I think you should encourage them. I think you should see somebody. If they are suicidal, the first thing you want to do is send them to the hospital. Call 911 for them. Call the ambulance for them. You understand? That's the least you can do to protect somebody and save a life. People have the tendency to attach too easily. Yes, attachment disorders, because you lack the foundational love, what love means, what love is. You lack that. You didn't receive any of that. So as a result, you look for it from the wrong places. Think about it. You look for love from the wrong places. And then you don't even know how to tell if this is genuine or this is not. I keep telling you guys that, like, it's not like I haven't dated before after my marriage. The problem is they think one thing I've noticed, they think that you are single, so you are desperate, you take anything. And the sad thing is that whenever you said we dropping the potato, we dropping it like hot potato. They feel depressed. They forgot. I have told myself I'm not staying in any relationship and get my emotions milked and sit in my bed counting sillies and having sleepless nights and anxiety. It's not happening. So when I get to sense, you tell me, you show me who you are for the first time, I take you for it. I take you for it. I believe you. And then when they come, oh my God, so you really mean it? Yes, I do. Oh, I'm sorry. Can we start up? Can I make it right to you? Oh no, it's okay. I'm fine. You should keep where you are. Stay right there, or you can find someone else. Most of the time, they are right there and they're still finding someone else in addition. But I refuse to be that addition. You are better. You deserve better. You set the standards to what you deserve. You don't have to be having anxiety attacks because of somebody. Especially if they don't feed you, they don't have a value in your life, they don't contribute to anything you do. What's the essence? You understand? So as we are talking about agoraphobia today, you should understand that all forms of anxiety brings these symptoms that are realistic to the person that is feeling these symptoms. It is their realistic perception. It's these symptoms, these things might not be real to you, me, or the general population, but they are real to them. The stress, the sweating, the choking sensation where they can't breathe. Let me tell you, when my dad died, I cried till I couldn't breathe. My throat was choked for days. I was having panic attacks for days. The sense that I couldn't see. August 4th is the day he died, so his 1 year anniversary is coming. The fact that I can't see him in that video call anymore. The fact that I could not gives me sleepless nights. And those symptoms were real. Those feelings, those sensations were real to me. But how would somebody that didn't have a family member died in, or in this situation what I was, see it as real? They'll be like, real people die all the time, child. My dear, God knows better. God knows best, No, I have learned the hard way to not tell people they are in a better place. No, which other place is better than having my dad here with me that I could talk to? Somebody that called my kids every day and told them he loved them. My dad would call only to say, where are the boys? Tell them I love them. He would put the phone in their ear just to tell them he loved them. He would say, okay, so bye-bye. That's it. My dad would just call to say, I love you, and say, take care of yourself. That's it. So it was real sensation I was having. Somebody that will hear those things, not see it as realistic. You see? So now that you know, I want you to know when those people are going through these things, know that they are real to people. Health boundaries. People have the tendency, to attach, too much. So you have to set healthy boundaries when you're in relationships. I always encourage people, go into it with your brain. You don't start dating somebody instantaneously because you are the Mother Christmas. You start sponsoring them, a young boy, you start sponsoring their education, you start showering them with money, gifts, and all that, thinking that will make them to be loyal and committed to you. No. Let them see your value, and as a result, treat you as the value you are worth, right? If they're treating you as a value you are not worth, you know your worth, so you cut it out and keep it moving. You see? So when we talk about agoraphobia, they said another symptom, another symptom you may have is what? You experience significant distress or problems with social situations. We've been talking about that all along when it comes to anxiety, right? Work or areas in your life because of the fear, anxiety, and avoidance. So now you are embarrassed you feel scared, terrified, you're going to have these embarrassing symptoms in public and somebody will see you in the moment and you feel embarrassed about it. As a result, you avoid those encounters, those symptoms, those spaces, those places that will make you feel these weird sensations and weird things that will make you feel embarrassed, right? Okay. Your phobia and avoidance usually last 6 months or longer. This is the criteria for being diagnosed with agoraphobia. These serious symptoms you are experiencing as a result of leaving your comfort zone, leaving your home to public spaces. Understand the gold standard for agoraphobia is what? The fear of places and also fear of different things, unlike specific phobias. You understand? In agoraphobia, you are scared of places, you are scared of spaces, you are scared of you have social phobia, objects, a lot of different things. And they say what? In order for you to be diagnosed, you must be having these symptoms for at least 6 months or longer. Mean that it is that bad that you can do what? You can go to work. If you can't come out of your house, can you go to work? No. Can you pay your bills? No. It becomes like a disability. So is this becoming debilitating and it's affecting your day-to-day life? It is affecting you having healthy lifestyle, working, enjoying social places and social encounters, relationships. Is it that bad? Okay. Are you comfortable enough to start opening up about it and tell somebody about it? Is the person listening to you somebody that is open-minded enough to know that even though they are not going through these things, you are going through it and it's real? Both of you together, are you willing to seek help? Is the person listening to you willing to provide you support and encourage you to reach out to a professional to get the right care? Okay, maybe you need medication. Okay, now that you are going to work, how do I deal with it? Let me take that propranolol. You can understand when you have anxiety, your panic attack, your blood pressure shoots, your heart rate goes up anyway. So you can take propranolol, which is what off-label medication. It's a blood pressure medication. It's used off-label for what? Anxiety disorders. And take it 30 minutes before you head on to work. While you're doing biofeedback exercises, deep breathing exercises. That's doing this to your fingers. The lung helps too to release some of the stress and the tension. Have you practiced exposure? You practice coming to the door, coming back. Practice coming to the door, coming back. You have that friend, that family member that will encourage you to do it, that will come actually and support you do it. Are you going to do that also to them if it was to be the other way around? Are you going to be that support, that stranger on the bus, on the train, standing in line, in queue, needs? Are you going to be that support that stranger needs? Yes, I know we have different illnesses out there, but I know you can do it. You will not be scared of the person giving you corona, right? And say you will not get close and give them support. You will call ambulance to come so that instead of today, when something is happening, people are rather quick to be recording versus providing support. Have you paid attention to that? Today, if something is happening to people's life, they are quick to shoot, to pull that phone and start recording the social media life we live in today. We don't give people privacy anymore. They will do that before they think of calling 911, before they think of getting you support. Think about it. Is that not something? That's interesting, right? Okay. Panic disorders and agoraphobia. Some people have panic disorder in addition to agoraphobia. Panic disorders is a type of anxiety disorder in which you experience sudden attacks of extreme fear that reaches what? A peak within a few minutes. And if you were here last week, we said it. We did panic disorder already on Facebook. panic disorders comes on. They didn't have trigger. They don't have to have a trigger. They just come on all of a sudden, and they must last at least 10 minutes. So some people have the panic disorder in addition to agoraphobia. So the panic disorder, as you know, it comes all of a sudden, right? But agoraphobia comes with, and all these things can be clustered. Somebody having anxiety can also have depression. So imagine having all that, then you have panic in addition. Oh my, you see. So it's important we get to know and strike the differences so we can provide the right support. The only thing that may be similar in these issues is that the symptoms, right? You are having tightness of the chest, you can't breathe, your blood pressure is up, your heart rate is up, all these things happen. So the physical changes is across, right? But when it comes to the specific types of anxiety, there are specific criteria to meet it. If it's not debilitating enough, it doesn't meet the timeline, 3 months, 6 months. If you have acute stress disorder, that is 30 days. You cannot have acute stress disorder after 30 days. You were raped. So as a result, you have acute stress disorder right now. You met a stranger on the street, somebody who is mentally impaired, they slapped you. You're gonna that flight, you're gonna have and fight rescue, you're gonna have that panic disorder that minute, and you're gonna have what's the name? Acute stress disorder. You're sleeping, you're having those symptoms like PTSD, you're having nightmares, you're having flashbacks. If it's less than 30 days, they cannot give you PTSD. You see the thing. So timelines are important, and that's why we count on you. We rely on you to give us all the details required to give you the best, or at least the right diagnosis, and that as a result you get the right treatment. Okay. Rapid heart rate, we know that, right? If you are here, this is the 6th week we're doing anxiety, you know the symptoms. Trouble breathing and feeling of choking, you know them. Chest pain or pressure, like you have like congestion, like your chest is so tightened and it's not relaxed enough, and it's so squeezing you, right? Versatile, right? Lightheadedness, dizziness, yes, you're gonna have them. Feeling shaky, oh yes, feeling shaky, right? And nervous and having tremors, yes, very common. Numbness and tingling, very common. Excessive sweating, yes. Diaphoresis, that's the word I've been trying to remember all along. Diaphoresis is the same as sweating, being sweaty. It's called diaphoresis in clinical, in clinical practice. Sudden flashing and chills. Sudden flashing and having chills, having goosebumps, Upset stomach and diarrhea. People don't understand. People will like, why? Understand that this thing is affecting all your systems. You have to feel relaxed for peristalsis to happen, right? Sometimes as a result, it's like when, God forbid, somebody passed away, how all their body loses up. You can pee on yourself. You can defecate on yourself when this terrifying moment comes, when these panics come. And on the other hand, some people will have this tightening of the stomach that they can't. I had that too when my dad passed away. Aside from having the choking sensation, I also had my stomach. I feel like, my God, my stomach was so tight, people. It was such an unhealthy feeling. But thank God, like I said, you have to have these symptoms lasting for over 6 months, 3 months, 6 months for you to be diagnosed with a disorder. But when they are normal, when they are happening acutely, it's a normal feeling that everybody goes through, because death is part of life. Happiness is part of life. Pain is part of life. So it's going to come. You're going to react to it. However, how you allow it to last, how you allow it to affect your day-to-day living, how better you cope, you're able to cope to sustain yourself, is what we try to teach here. Okay, we are on it, and we are going to finish, and we are going to get to coping, okay, in a minute. You see that? So upset stomach, diarrhea, stomach tightening, feeling or loss in control. Of course, you want to be in control. But when these things happen, you don't have control. You can imagine seeing me on social media crying uncontrollably when my dad passed away. It's not funny. It was serious, right? So you can't even control yourself. You understand? Fear of dying. When people are going through this kind of panics and this kind of anxiety, sometimes they are scared they are going to die. They are scared. They kind of perceive their death in front of them. They feel like, I can't breathe. I'm choking. I can't have enough air into my body to keep me alive. You see? So it's a when to see a doctor. Agoraphobia can severely limit your ability to socialize, to work, to attend important events, and even manage the details of day-to-day activity, day-to-day life, such as numbing errands. Sometimes, like even running your own day-to-day life, running errands, going to your kids' events in school, going to see a friend in a hospital that is sick, going to see a friend that just had a baby. Because you have these symptoms, it becomes terrifying for you to even imagine leaving your comfort zone, leaving your close environment, and live out of the house, out of being scared of spaces. You see how your life can be affected? Can't go to work. How can you work when you are going to be exposed to people and to spaces constantly? So you become a disabled person, despite the fact that you are healthy. Miss Paula said, don't like anything crawling or flying or the insects, the bugs, right? I don't do airplanes either. Oh my. Miss Linda Berkins, you have a partner here. You both have to start it because Miss Reese, you're coming with me, all right? You're coming with me to Ghana next year. So start working on it. Get yourself on that international, what's the name? Domestic flights before the end of the year and give me feedback. You see that? So how are you going to have an enjoyable life? Don't let agoraphobia make your world smaller. Call your doctor if you have signs of these things we talk about. Okay, call your doctor. There's a causes of agoraphobia. Biology, when you have a family history, that is definitely one of the genetics. When you have genetically somebody in your family has a history, like a third generation, like your mom, your sibling, your uncle, your father, kind of this can happen. Okay. Including health conditions and genetics. Yeah, that's biology. Temperament, yes. Environmental stress and learning experiences may all play a role in the development of agoraphobia. Learning experiences. I forgot. Somebody made a comment this today. Maybe it's on. Where's my other phone? Someone has my small phone. See if it's on the charger. And I think I took a picture of it so that we will. I thought it was
It's right there.
All right, can you please get it for me? Thank you. Let me see if I find it. Okay, somebody had a comment today. That was Miss Tanya. Miss Tanya said, I forgot what post it was. Oh, it was a video I did with the girl that, I think it was the wife that bent the whole house down with her husband that cheated and had a baby in it, and she took her own life too. Miss Tanya said, it is possible that the wife is it's either that one or this person, Kofi Aduma's wife. I think either or, the one that paid rent and how for houses for their husband to be in it with other women and have babies, and now the man says he has repented and talking about it. So it's either the one of or the other women. So she said it is possible that the wife is suffering from learned victimhood from childhood. So I took a screenshot of it so I can look into that, and that would be a good topic for us to talk about. And from childhood, you know, that's very important to me because we need to talk about these things to eradicate it from their childhood so they don't grow up to become. I'm live, so I don't need disturbance, please. Not today. You see what I'm saying? That we will learn about it. September, I will be flying. Nice, nice, Miss Linda. Miss Reese, are you joining Miss Linda? That need to happen this year because someone next year you coming with me. All right. You see, so risk factors. What are the risk factors for to have agoraphobia? What puts you at increased risk? Agoraphobia can begin in childhood, but usually starts in the late teen and early adult years. Usually before the age of 35. Usually what? Before the age of 35. Understand that age and duration plays a role in diagnosing people. Okay. But older adults can also develop it. Women are diagnosed with agoraphobia more often than men. With all that we go through, we are highly, highly, highly at risk. So all these other forms of panic attacks, we are at risk, people. What does that tell you? You need to learn about it the more, and you need to investigate it more, and you need to develop coping mechanisms for yourself and practice them, things that will help calm your nerves down so that you are not exposing yourself to these symptoms debilitating you. They will come, but you could cope with them better and they won't crumble, they won't make you disabled. You see that? Okay. Risk factors for agoraphobia include having panic disorder or other phobias. Yes, possible. Responding to panic attacks with excessive fear and avoidance. Experiencing stressful life events. Yes. Such as abuse. You can now understand why it affects us the most, right? Okay. The death of a parent or being attacked. So you see, now I know it was so realistic that I had the symptoms I had when my dad passed away. It's Kofi's wife, great. So Miss Tanya is telling us that Kofi's wife possibly is the one that could possibly be suffering from what? Learned victimhood from childhood. So I'm just going to take a screenshot of this so I remember myself, so I know which person it's related to. Learned victimization from childhood, learned victimhood, and learned helplessness. Example, no one wants to help me. I cannot do this for myself, but no one. Oduma, how are you, my love? But no one will help me. Everyone leaves me. See? So they hold on. And you know what? That's a good, I think this is a topic we need to treat. So she's holding on to Kofi, good or bad. It makes sense. We have to look into that. So that's a good topic for us to learn. And if we can deal with it and help our children today, the more we learn and the more we help our kids, the more we change our habits, help the kids. It positively impacts their life and brings the change that we so desire to have and see in them. Hello, Oduma said, hello everyone. I'm late here, not feeling well. I know. How are you feeling now? I hope you get better. And I really hope that you get to see the doctor. Go and see the doctor. All right. I love you, sis. Having an anxious or nervous temperament, having a blood relative Agoraphobia. We talk about that. You see, so understand that when you are a woman, your risk is high. When you are menopausal age, premenopausal and menopausal age with changes in your hormonal imbalances, you are at risk. Family, genetics, you are at risk. If you have a history of other forms of anxiety and panic disorders, you are at risk. Okay. And so learning coping mechanisms will help us get through these feelings and symptoms. A lot of things that I've been through in life, if I didn't know much about mental health, I think I would have been dead by now, because I have had some quite a bit. And as you know, I'm still taking care of kids as a result of that. So you know, definitely it's not an easy task, but I'm still doing well to the best of my my ability, sometimes based on my the people I talk to and also my knowledge in mental health. One thing I will tell you is, whilst I didn't have anybody like Cora, at least Cora is on social media, I went through it alone. The only thing I thought helped me so well was that psychiatric nurse rotation in associate degree when I was in my associate degree. To me, that class was using one stone to kill two birds. I was studying to pass an exam and eventually become a nurse. However, I was also I was understanding all the things that were happening to me. Okay, so this is why I felt this way. Oh, this is why this was happening. Oh, this is why this was happening. And the coping strategies I was using, because they will tell you as a nursing what it will be they will give you the vinaigrette. What is the nursing diagnosis will you provide to this patient? What are the nursing interventions? So I'm learning to teach a client, to teach a patient. I am using that for me too. When I was going through the crisis phase of my divorce, my separation, and my abuse, that was my outlet to get help, right? Through my education. It just came handy because when I went back to school after everything, the first classes I did in nursing school was PITS. And I think I told you the story with my PITS class. Then after that, my psych class. So my psych class was really like a whole therapy for me. Hi, Miss Stephanie. See, they are finding us. They are finding us. Miss Reese is talking to you, Duma. You know how you can reply, like Facebook, you can reply to people. This one, you do at, and then you type the person's name and it will come. Okay, so you can reply directly to each other to here, just like Facebook. Okay. With time, if I'm able to learn how to set up well, I'll be putting the comments also, just like we read on Facebook. But here you can, even with the StreamYard app, you can put the comments also on the specific comments so that the person gets to know, oh, you are talking to them. I will learn about all those things and we'll set up. One day we'll grow and we'll set up whereby even I don't have to read away. I'll be looking on the same screen and be reading next to it. Okay, that's my dream. So your support is needed. Okay, we hope that we get the stars, but we hope that we get the if you can let people can subscribe. And here too, you can support here too, I believe. Hi, Miss Gladys. Oh, Miss Gladys too found us. Miss definitely found us. Miss Gladys found us. Great. You came late, but you can always go back and watch. But we still have some good points. We haven't even gotten to open yet. So you see. So you see complications. What are the complications that you can have with agoraphobia? If you are here, I'm sure you should know. You can even imagine some already. Imagine being diabetic. Imagine being somebody that have depression. Imagine being somebody that have high blood pressure. Can you already start thinking about how all these things can complicate your blood pressure issues? You might end up having heart attack when you shouldn't be having heart attack, just because of the extreme nature, debilitating nature of your anxiety and your panic. You see, they say agoraphobia can greatly limit your life activities. If your agoraphobia is severe, you may not even be able to leave your home. I have stressed that. That is one gold standard also that they use to judge either whether you have agoraphobia or whether you have any other specific phobia. You understand? Agoraphobia, you can't leave your home. You are scared of places, so you are just staying in home. And even in your home, most instances I've known you are stuck in your room alone. You can't even get out of your room and go downstairs. And as you gain that weight, you eat and all the mess around you, depression, right? All the food you are eating, blood pressure, cholesterol, diabetes, need to get out, right? Exercise. Exercise goes a long way. Have an exercise body, do something, right? Without treatment, some people become house bound for years. I said this thing from the beginning. You may not be able to visit with family or friends, go to school or work, run errands, or take part in other normal daily activities. You may become dependent on others for help. That's how debilitating agoraphobia can be. Agoraphobia can also lead to or be associated with depression. I said that already without even knowing it's coming. Alcohol and drug use, yes, because you are depressed, you are stressed, you are so people tend to drugs so they can feel better about these symptoms. Unfortunately, what happened? The alcohol will kind of those you make you tipsy to forget about the situation 1 second. The drug, next minute, it's back even worse with worse symptoms. But now you are going to be withdrawing from the alcohol, and you are also going to be faced with a problem. So now you are complicating your situation. Why you need to seek help very, very early. Other mental health disorders, including other anxiety disorders and other personality disorders. You see that? You see how it goes. Prevention. Yes, that's the best part. Prevention. How do you prevent it? There's no sure way to prevent agoraphobia. I think you can prevent it. If it's going to happen and this is you, it's going to happen. However, you're going to learn the coping skills. That's my part. You're going to learn to reach out and seek help. You're going to learn to not allow it to become disabling to you and prevent you from functioning. You understand? However, anxiety tends to increase the more you avoid situations that you are scared of. If you start to have mild fears about going places that are safe, try to practice going to those places over and over again before your fear becomes overwhelming. See what I'm saying? So when you start realizing you are beginning to develop fear to these things, start exposure therapy. Start doing that to yourself little by little. Tell somebody about it. Say, I need you to help me. I don't think I need to see therapists for this. I know the result is what the therapy will tell me is to do exposure therapy. The doctor or the nurse practitioner or the therapist will not come and do the exposure with you. Because there is no therapy, I don't think, unless you have a therapist like me. I do concierge services, right? I can come to your home also, but that I charge extra. Like, you can have concierge service. Concierge therapy is like how Michael Jackson can have a private provider that will give them a different, what's the name of the medication? That will be pushing drugs with them. That's the assumption, people. That's what they claim in the news, right? That's the same thing. That is like concierge service. So that one, you have one-on-one service. Can you close the door? I don't want the noise coming out.
No, I didn't take it. I didn't have it in the pocket and play it there.
Sorry, guys. So you see, you can start your own anxiety and exposure therapy. Get help, get a body. Like so I was explaining concierge service that I provide. Like I have a client right now, she's 70 years old that I need to go see. I need to see them in person versus seeing them virtually for the first visit at least. So if you have me as your concierge provider, right, I can be that that work partner with you. So the 1 hour I'm going to see you, we are going to do exposure therapy. And we're going to go to the place. That's where we're going to have our session. To the place that you are scared of, to that bridge that you are scared of. We'll meet there. So we'll meet at a distance away from it and maybe give you a sight of it. You turn and stare it. So we do the introduction, and bit by bit, every time we go there, we're going to have like a 30 minutes, maybe 15 minutes at the site. So you're going to be seeing it. Then after that, we go away. We expose you to it at a distance. So every time we go there for the next 12 weeks that you are doing this, we are going to be increasing the closeness. So we start from a distance where you are just staring it from afar and then talking yourself out of it, and writing journals when you go home to displace the thoughts, right? We go back again, we get closer, we go back, we get closer, we go back, we get closer. So each time we go, we get closer till you overcome that fear. You can do that with a friend. So you don't sit down till it becomes debilitating, where you can't even get out of your home. You see what I'm saying? Okay. It says what? Yeah. So you start to have mild fears. If you start to have mild fears, when you start to have all these symptoms, these are the things you can do. Start exposing yourself to it. To go to places that are safe, get help from a body, your friend, your family member, even your child or it's important our kids understand we are there for them and they should tell us about this fear. So we will help them too, right? Because these things I'm telling you, if you go to therapy, those are the things they will tell you. Unless, actually, I tell you more. I tell you like details. Clinically, what you need to know for exams and stuff, I tell you. But you come in practice, people don't necessarily always have the time to be realistic and to do these things. So why won't you come to EPA? So you learn and instead of going to pay therapy, get a friend, get a study buddy, get a coping buddy, a work buddy, and tell yourself, I'm going to do this, but help me, take me there. And when I'm screaming, just hold my hands tight and just lean on them. Let them be your support and you be their support and take them through that phase. It's not going to happen one day. It's going to be, you're going to achieve it with dedication and effort. Okay? And consistency, practice doing it bit by bit. If this is too hard to do, if this is too hard to you or your own, ask a family member or friend to go with you or seek professional help. And said all that already. Sometimes it's interesting that I say the things before I read myself. I'm repeating myself. But that is because I haven't read the article prior. I glanced through the main topic, the headings, and say, this is what I'm looking for. Yes, this covers all the basics I want to. But I want to teach you about the same thing. I want to teach you about how to look out for it. I want to teach you about how it affects you. And then most important, I want to teach you about treatment and coping. So if I can see all the major headlines involved in the research, then great, I'm ready to use it. Sometimes we look at those similar things like that, like the two, I've compared 2 or 3 and choose one. But I want to give you the best. If you experience anxiety going places or have a panic attack or have panic attacks, get treatment as soon as possible. Get help early to keep symptoms from getting worse. Anxiety, like many other mental health conditions, can be harder to treat if you wait too long. And that is a fact. Treating agoraphobia, a stepwise approach, is usually recommended. A stepwise approach is usually recommended for treating agoraphobia and other underlying panic attacks. The steps are as follows. Steps involved in treating agoraphobia. Number one, find out more about your condition. The lifestyle changes you can make. You know what I'm saying? Maybe you need to walk, exposure, I was saying. So these things, you can learn them free from here, but they are not free when you go in therapy. And self-help techniques to help relieve symptoms. We have self-help techniques here. I can click on it and we have a whole article opening for us, but we don't want to do that. So now you know, you can just even research what are some of the self-help techniques I can do for somebody who have agoraphobia, for Miss Beckins who have flight traveling problem, a phobia with traveling on the being on the in the air, somebody that have a problem with the bugs. Who was that? Miss Reese with the insects, and then somebody also had issue with snakes and worms. Oh, snakes and worms. Me, I don't like snakes and worms for sure. I don't like dogs too. I don't like dogs, but it's not that bad that I have phobia or anything with it. No, but I just would rather stay away from it. I have a big sister that passed away from rabies. So definitely dogs are not my thing. I don't mind having a little bird or cat as a pet, but not a dog for sure. Enroll yourself in the guided self-help programs, like being a group here. To me, I see here as a group really, because we are learning, and somebody can live here learning some of these techniques, and it will be helpful to them. Deep breathing exercises. So self-help programs, self-help groups is what they are suggesting. Undertake more intensive treatment, such as cognitive behavior therapy, or see if your symptoms can be controlled using medication. So you first assess the condition, evaluate yourself, talk to somebody. What do you think is going on? What do you think I will benefit from? That's number one. Number two is when it's still not bad yet. Number one is like it's happening. Oh, really? What are these symptoms? Let me investigate it. Let me find out what's going on. Number two is now you get to know, wow, let me find myself self-help tools, right? Number three is like, it's debilitating. So what do we do now? It says what? Undertake a more intensive treatment, including CBT, because understand it is the mind that is deceiving you. That made this thing, this fear is real and is really going to happen. It's not the reality for the whole world, but just you. It's your brain that is deceiving you. So you need to engage in the cognitive behavior therapy that they will help you. So as a result of the unrealistic fears and the mind deceiving you about these fears and that you're going to die in that. So as a result, the behavior that is coming with it is, I don't want to go out. I'm scared of this space, so I'm staying in my house. No, I don't want to deal with it. You see, so as a result of the cognition, we see it in behavior. So if you can decide to realize that now that you came here, did you die? You didn't die, did you? We all are living, right? So bit by bit in the exposure therapy, you understand exposure therapy is part of cognitive therapy in a way. That helps with the behavior modification, right? And then sometimes there are some food items that can increase anxiety. Alcohol, drugs, certain drugs can cause anxiety. I told you drinking soda can make you to have withdrawal symptoms when the soda is getting out of the system. You'll be shaky, you have tremors and stuff. So lifestyle changes when you get to know, oh, what could be triggering this symptom. You know, since I told you about what happened to me the last time I took coke, like 2 months ago, going to the VA to draw prescription. I changed. Now, the last time I went to work, I bought McDonald's. I took Fanta instead of Coke. And Coke has always been once in a while, if I'm eating something like McDonald's fast food, I'll get Coke. But now I walk away from Coke. So you see, you assess yourself, you figure out what the issue is, what triggered it, what was the precipitating factors, meaning that what were the activities or the food or the things I did and prior to these symptoms coming on, you see, then eventually you get through helping yourself. Now that you know is this food, you connected the symptom to this food, connected the symptom from, oh, it's because since my dad died, that's when I started having these symptoms. Okay, that is gone now, right? I still have to work and feed these kids, right? So what do we do? We start working on it. Miss Grant said, Oduma, get well soon. Yes, Oduma, get well soon, okay? Okay, Miss Paula said, Miss Reese said, Miss Grant said, Miss Reese, I also have the same symptom. And some cold medicine can give you anxiety and of caffeine. Yes, Oduma is so right on that. Some cold medications, when they are withdrawing, like those medications that they say you should take at night, Robitussin DM. There's another form of Robitussin that is actually, it has codeine in it. When you take that and you are waking up in the morning, you feel drowsy, you feel like going back to sleep again. You see, so medications can also impact your life. Caffeine, definitely. Coffee is me. I don't take coffee. Let me tell you, the last time I took coffee was maybe over 20 years ago in Ghana when I was in college. Because you guys know, I am first a teacher before a nurse. Being a nurse or being a nurse practitioner is a change in career for me. So in Ghana, I went to Teachers Training College, and we stay up night to study for exams and all that, prepare for all those exams and so. And sometimes I rely on coffee. I began having ulcer, my stomach and stuff. Since then to today, the smell of coffee alone is too much for me. And coffee can have impact on your blood pressure. It will diurese you, it causes you to pee a lot. And so it's affecting your, I'm not saying don't take it. You need it, but how much do you need is what you need to discuss with your doctor. To understand when you come here, this is not a place where we treat. This is a place where we get to get informed about these conditions. As a result, we move away and start working on it. Like, okay, now that I've gotten informed with this and that, what can I do to start changing the situation? I need to start doing something about it. I need to talk to a doctor about it. But let me talk to my friend and see if she can help me to go on a walk with me or come and sleep over with me. So tomorrow morning we can take a little exposure practice, do a little exposure exercise. You see, ginger, thyme, garlic, lemon, orange with hot water and honey helps. See, we are learning, others are sharing, and I'm a herb girl, right? I love me my herbs. Ginger, garlic. The only spice I use is probably Jamaican curry powder. Ginger, garlic and jalapeno pepper. That's what I use, and ginger to season my meat and stuff. Caffeine, nothing for me. Exactly, me too. I don't take coffee. I am, I wouldn't say I'm the best person when it comes to health, despite all I do. I wouldn't say I'm in the best of health because I don't have a good bone health, So the cholesterol is one big thing that affects a lot of aspects of your life because it affects your ability to have be exposed to diabetes, cardiovascular problems. Cholesterol is dangerous. Yes, we used to brew cola nuts to keep awake during exams. Ooh, they used to chew cola nuts so they can stay awake at night to study. We were using caffeine, or caffeine, whatever, and it wasn't good for me. So I haven't taken. I don't take it at all. Self-help techniques and lifestyle changes. learning more about agoraphobia and its association with panic and panic attacks may help you control your symptoms better. You see, so that's what we're doing here. Like, you learning about the condition is what is going to help you manage it or deal with it in a more healthy way. If you don't know, you don't know. And you are being what? Corrupt. You are corrupt. You can see platforms that want to lie about you, lie to you and tell you they do this, they treat this, they treat that. You be listening to them. But if you yourself make efforts to decide and pick healthy platforms that you're going to learn something from, eventually you're going to research when you're having these symptoms. You're going to research more. You're going to deal with it more. You're going to work on getting the right care with the right provider. And even by listening to me alone, when you leave and you are talking to a doctor, you know the questions to ask them. If they don't know, you will know. There are doctors out there that don't necessarily know everything. So then it becomes your call to, let me not go back there next time. Find a different one. You see what I'm saying? Yes, okay, for example, Miss Linda said, Tanya, all those herbs you named are good for detoxification. See, my people, they know they are for detoxing. I was telling Oduma yesterday about some of these things. They are for detoxing, which we all need once in a while. You should be detoxing yourself at least once a month, especially if you are in this our age going, which we all are, right? Not with all of us, but maybe some majority of us, at least when it comes to my platform, majority of us are. Years ago, Miss Caroline said, years ago, I took Teraflu or flu for flu-like symptoms. I started hallucinating. Ooh, and I will never take that again. See that? You see that? So medication have side effects, especially these sedating cough treatments. So obviously, these have one of the, either the opioid one, like the one I was saying, like Robitussin DM, or the one that have codeine in it, can cause you to have that also. When you're taking anxiety and depression medications, it can cause you to have hallucinations. When you have those, you have to stop taking them immediately. You find yourself to the hospital immediately so they can give you fluids to get it out of the system. It can detox you. Okay. I used to drink that all the time, especially when I had COVID. I was feeling better in 4 days. Yes. Me, when I was telling some of the Oduma, some of the concussions, Oduma is not feeling well. Let's pray for her too. And then I was telling her, when I do it, I make it hot and the burning sensation. Sometimes in Ghana like this, you can put choke. I don't know about you, wintia. They can't say wintia. What's the English name for wintia? If you know Oduma, anybody know, put it so that our non-Ghanaians because we know. It's a black herb. It's like black and it has seeds in them and it's like long, thin and long. You put it in cocoa, Hausa cocoa porridge. The flavor, the aroma, that and ginger. If you crush it, put it in porridge. That is also good. It suits the sensation in your throat and your chest. Because it's medicinal. But one thing you should know is the 3 G's, ginkgo, ginger, and some other, was the the other gene, I forgot what it is. When you are taking this, be careful when you are taking them with other medications like blood thinners. Make sure you are always telling your doctor about it, but they can have some either cumulative effects, synergistic effects, or they can have negative effects, meaning they can affect the effect of your medication. It can decrease the effect of your medication, or they can have additive effects, meaning synergistic effect. And that means that you should be taking maybe 5 milligrams of your medication. If you are taking ginger or ginkgo or garlic or those things, they increase the effect. So that means you should be taking that your medication 2.5, half of the dose instead of full dose, because these herbs are also providing the same value, so adding to the strength, to the ability the work this one is doing, the medicine is doing. So always discuss with your doctor when you are doing this thing. Now, Papo, let's see who this person is. Pepper grains. Okay. Selling pepper grains. So somebody is telling us what hintia is, what I was talking about in Ghana. Ghana we call it hintia. In my dialect in Ghana we call it cho or so. So he said it's called selling pepper grains. Okay. I do drink a cup of coffee daily without sugar. Yes. So today, if I'm taking, you know what is my sugar? Lemon. Oh man, if I have my lemon juice squeezed into my herbal drinks, I do. Even if I can get like Camelin, those tea bags, and I squeeze my lemon in it. That's my sugar. I don't eat sugar. I don't take sugar with nothing with my tea. No. Yes, it does give energy. It's a stimulant, of course. It will give you energy or impact my sleeping. Yes. So in the morning you need it. Some people do to stay awake so they can stay energized. It's a stimulant. Caffeine is a medicine. It's medicine now. It's a drug really. So you use it to keep you awake and get you started and keep you going. But depending on what time it is of the day, if you are insomniac, you are a person that have insomnia, sleep disorders, which we're going to talk about them when the time comes. You want to stay away from coffee at certain time of the day. Early day time of the day, if you need it, go for it, but not at certain times when you need to sleep. I meant coffee doesn't give me energy. Oh, it doesn't, or impact my sleep pattern. Wow, then you are lucky. She is one of the lucky ones. If coffee doesn't give you sleeplessness, but it doesn't give you energy, so why do you take it? It keeps you awake. It doesn't keep you awake. I want to understand. If it doesn't keep you awake, then you are lucky because, but if it doesn't give you, you need it to keep you awake and keep you energized. So why would you take it then if it doesn't give you that? And what then? Okay, so why do you take it? What purpose does it serve for you? What is the rationale for taking it then? Because these are the effects. The positive effect is to keep you stimulated. The negative effect is to keep you awake when you need to sleep, right? So if it's not doing neither the good nor the bad of this, then why are you taking it? Okay, it's called Salim Pod. Okay, that's what Natu said. Thank you both. Coffee makes me drunk in public. Miss Reed has a funny or interesting effect to coffee. It makes her feel drunk. Wow, interesting. See, it's good you guys are sharing because then us just look at it like, oh, this is the medically, this is what it does. I know it has an impact on your blood pressure too. Wow. Garlic, Miss Linda, garlic, be careful of if you are taking blood thinners. Yes. Ginger, ginkgo, garlic, and the other G's, 3 G's. Ginkgo, ginger, garlic, and other things. So always make sure when you are taking these things. In Africa, people just take garlic, they chew it. It's very healthy. If you're doing that alone, what garlic does it? Garlic can improve your cholesterol. You see, if you're taking garlic, sometimes you can, when you perspirate, it smells on your body. That is to tell you how much medicinal it is. It brings toxins out of your body. So if you take it in large quantity, like people I'm talking about do. Now I'm thinking that probably is Nana. I don't know who that is, but my big son's middle name is Jemfi. I get a terrible headache when I drink coffee. Yes, coffee has a lot of impact on your somatic health. So depending on your age, if you can try to win yourself with it, I would say it's helpful. Okay. Miss Jai is here. What are the best natural herbs for energy? That's a good topic. A good something to research on, right? I wouldn't wanna say it, wanna tell you something that I don't know much about. Where is it? Is it gone? For energy. I know GABA. GABA stimulates your mood, keeps you lively. But understand that these things, they are all they don't have the natural values they have. We are not in Africa where you see them in their natural state. That's the only issue I have. You know, if you that's the only issue I have. If you are taking the capsules, you can imagine. But if you can see it, I told you guys, I want to know the value, what is in the thing I'm taking. So if you are looking at it and you're taking it the real, then you know this is really what I'm taking. That's the only way. But to take the capsules and stuff, I don't know. Mr. said, in my dad's culture, they drink coffee after a meal. Ooh, I see. My doctor said it was the combination of ingredients in Terraflu that made me feel that way. Yes, yes, which I've said that some of those Robitussin, they come in different forms. They have the daily one, the evening one, which means the one that has sleep aid in it. Then we have one with codeine in it. The compositions are different. All those cup formulations. Some of them you need ID to buy them over the counter. So if you are going through a lot of like what Oduma, I would say you should go and talk about Robitussin also and tell them you want the one with the codeine. They will ask of your ID. You don't need it all the time, but you need it for especially the symptoms to go away so you feel yourself again. I drink for pleasure. Okay. So this is why Miss Linda drinks coffee, even though it doesn't impact her life. It doesn't give her any benefit. she decided to add the toxin to her body as a pleasure. Okay, good. That's okay. Okay, I will check it out. Okay, that's Miss Jai. Miss Caroline said that should be cute to talk to someone who chews on garlic in large quantities. That's somebody's fantasy. To be cute to talk to somebody who chews garlic in large quantities. Somebody's fantasy. All right. Yes, in Africa, you see people do that a lot. I don't even hear people like Indians who also believe in herbs. Yes. Mr. Caroline, that's funny. Beets, oh yes, beetroots helps reduce blood pressure. Yes, beetroots have a lot of, also have medicinal components to it. Coffee gives me palpitation. See, Oduma said coffee gives her palpitation. Palpitation. I can not take caffeine at all. Yes, me, I can take it because of my GI symptoms. But definitely, caffeine has a lot of negative somatic health effects, and you don't want to do with it. Physical health is important to me, and it should be important to you. Okay. Okay. So, for example, there are techniques you can use during a panic attack to bring your emotions under control. That is self-help techniques that they are going to talk about now. Having more confidence in controlling your emotions may make you more confident coping with previously uncomfortable situations and environments. Stay where you are. That's number one. They said you should stay where you are. Try to resist the urge to run to a place for safety when you get to go to do that exposure therapy. Try to stay where you are. Try to not feel so panic enough that you're going to want to run away. and not face your fear. That's why you're going to come without your body, your friend, or hire me, the concierge service provider, and I'll come and do that with you. It will be my pleasure to do that. You see that? So it says stay where you are. Try not to run away to a safer place, a safe place of safety. You have to deal with this fear. So you're going to have to stay and deal with it rather than running away. Okay. The other thing is say focus, remain focused. You know, in this, if you are not focused, how are you going to get rid of that sensation, that feeling, that terrifying, horrific perception you have about this object, about this space, about this where you are supposed to be at? You have to stay focused and be determined. It's important for you to focus on something non-threatening and visible. So if it's that, you know, focus on the walk. You are walking with your friend. Don't look at it. Let's say the bridge you are walking towards, or your therapist. Hold the hand and just be walking. Focus on your legs movement. Your leg movement is not terrifying. You're going like that, right? And you're focusing. And then when you get there, close enough, based on the agreed treatment plan, the therapist stop. Hold my hand. Take a deep breath. Now 10. Close your eyes. And 10. And face your fear. So she talks you through it. She talks you through the deep breathing, the biofeedback exercises. And then what? They ask you to open your mouth slowly, your eyes slowly, whilst you are taking a deep breath, right? Voila. You get to see it. You'll be terrifying. But you can do that, and then for a few seconds, you look, you close, few seconds, you look, you close. 5, 10 minutes, you are gone. Come back again and do it. This time you get close to the point where you're going to end up touching the object or getting really to the space that you are scared of. You know, see that? You stay focused, and such as time passing or your watch. Yeah, in this case, we say focus on your steps, right? Or items of what in the supermarket. Yeah, you know, looking at the terrifying object. That's other thing. Remind yourself the frightening thoughts and sensations are a sign of a panic and will eventually pass, which is true. They are symptoms. The panic symptoms, the difficulty breathing, the tremors, the hyperventilation, the diaphoresis, they are symptoms. So they will go away if you can get it. They are symptoms of the panic attack. If you can get the panic under control, those symptoms will also go away. Breathe slowly and deeply. I can't stress that enough. We've been talking about deep breathing exercises for a very long time. Think deep breathe slowly and deeply. You know just this one, you know what it did to my brain? It increased a lot of oxygen in my brain. It helped me. I feel calm down already. You see, so these are evidence-based approaches that has been thought to be very practical and effective. You do them, you practice them, and you make them part of yourself and your life when you are you're having a perceived threat or a real threat. Okay. Feelings of panic and anxiety can get worse if you breathe too quickly. Okay. So why it's important to breathe slowly and deeply. Try to focus on slow, deep breathing while counting slowly to 3 on each breath, in and out. So when you are taking breaths, in and out breathing, you have to count 1 to 3. So if you can count 1 to 3, meaning you are breathing slowly enough. But they say if you breathe, you are hasty in your breathing, it's going to cause you to have what? To complicate your panic symptoms. Yeah, Miss Caroline, we know that was a fun one though. Beets are good for blood pressure. I eat them often. Yes, I love beets. Like my kids love to, when I don't like going to Golden Carol much, but my kids love it there because of the assorted things they can pick from. They don't have to be restricted to a menu. So even if I'm offering for us to go to a nice restaurant, they don't want to. They want to go there. So when I go there, I eat something like salad, chocolate ice cream, and also beetroots. I love it. It's very good. Then you have the next thing they say you should do is challenge your fear. That is exposing yourself to it. Challenge your fear. Try to work out what it is you are scared of and challenge it. Whatever you feel terrified about, challenge those fears. You can archive this by constantly reminding yourself, the cognitive and then behavior. So the cognitive part, you constantly reminding yourself that what you fear is not real. It will pass by. And it's true, right? What you are scared of, is it real? And that's what the therapist will try to help you realize. Cognitive, work with your brain so you realize that the false perceptions that you are having about this fear, they're unrealistic. The fears you're having, the scare, they are not realistic. So you have to talk yourself out of it. Write a journal about it. When my sister stepped to the door, did she die? She didn't, right? When my son stepped to the door, did he die? He didn't, right? So would I die if I step to the door? Let me try it and see. Ooh, I did it, right? And it becomes an achievement when you actually could do it. Celebrate it. Your children have this kind of fear, this kind of anxiety. Celebrate them when they meet a milestone. Celebrate them when they have done something great. Positive reinforcement, remember? Miss Eppa, you guys be calling me Miss Eppa. You make me feel like I'm old. Eppa is fine. Miss Eppa, I will join again if you are still here. Sure, I have a call. No worries. Caroline said, have a good evening. Oh, she was talking to. I appreciate the information that you shared. Yes. At Paula, that's Miss Linda Beck. At Paula, I just started juicing bit daily. Oh, nice. Nice. Right on the health track there, Miss Linda. I'm trying to get off the blood pressure medicine. Ooh, nice, 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 nice. It's it passes through your stool. Looks so bloody. It will, because you see how even if you touch it, yeah. At least that's a good information. So for you who may want to try it, when you see that, another thing that is so good is kale for cholesterol too. Kale, lemon, fresh lemon. Look on the page. There is a weight loss smoothie I did. I'll share it to the group, the subscribers group, so you can see it. Kale, cucumber, green apple, the green bitter apple, the one that is not so sweet. A kale, depending on how much you want. Green apple, the green apple, hard green apple, one of it. Cucumber, blend it. I add assorted berries, especially I put like 1 or 2 strawberries and maybe raspberry, and then blend it and cut a lemon, half lemon. Put that lemon juice in it. Squeeze the lemon juice in it, and then clean all the pulp and put it in it. Blend this to make it a smoothie. Don't add any of those sweetening things. Take this daily to replace a meal, or take this 3 or 4 times a week consistently. Come and give me feedback about your weight management, if it's going for you or not. All right, that's one thing I can throw in there for you. So challenge your fears. We talk about that, right? Where you have to be constantly reminding yourself that these fears are not real. Creative visualization. That is when the mindfulness comes in. Imaginary therapy, imagery, right? So you're picturing how it could be when you go there. So let's creative visualization. During a panic attack, try to resist the urge to take negative thoughts to think negative thoughts, such as disaster. Instead, think of a place or situation that makes you feel peaceful. Imaginary therapy. You are sitting right here, but you are at the beach. You close your eyes, you are zooming, you are imagining, you are imagining being at the beach and seeing all the waves, and you know how the waves calms you down, the sound of the waves. Me, I love it. And then when you're at the beach, early morning, those definitely Miss Linda is going to experience this if we go to Ghana. So join her next year. Let's go have fun. You see the moist that comes from the sea hitting your face, hitting your skin, hitting your body is heavenly. Okay, so creative visualization, that is imaginary therapy. Okay, so instead of thinking of a disaster, you think about that a negative thought. Replace those thoughts with what places or situations that makes you feel peaceful, relaxed, or at ease. Once you have this image in your mind, try to focus your attention on it. This is helpful. Me, I can tell you this is helpful. I don't necessarily do it that way, but I have done these things before and it's helpful. Not because I was in under stress or anything, but I'm just in Ghana on vacation and I spend mornings with breakfast at the beach. Yeah. Do not fight or on attacks. When the attacks are coming, don't fight them. Don't fight them. Just relax and try to help yourself with your implement your coping mechanisms, coping skills we learned here today. Excuse me. Trying to fight the symptoms of panic attack can often make things worse. Instead, reassure yourself by accepting that although it may seem embarrassing and the symptoms are uncomfortable right now, right? They are difficult to deal with. Their attacks are not life-threatening. They are not. They are not. They are self-limited. They will go away. They are happening because of the symptoms. Because they are symptoms of what you are dealing with. If you can get what you are dealing with under control, this will go away. It's embarrassing for your friends to see you be in the public space and have to have this symptom. But positive self-talk, get these things out of the way. Making some lifestyle changes can also help. Yes, we've talked about a lot here today, lifestyle changes. Take regular exercise. Exercise can help relieve stress and tension and improve your mood. Yes, we know that already by now. If you're falling apart, that is one thing of stress and stress and stress. Research has shown that exercise alone without medication can resolve depression. Have a healthy diet. Talk about that. A poor diet can make the symptoms of panic and anxiety worse. Food, medication, stress, situation can make all these symptoms, any situation worse. Avoid using drugs and alcohol. We talk about that. That is even the worst route to go. To be using them, they will momentarily help you. But after that 15 minutes, 30 minutes, 1 hour, when you are euphoric, when you start withdrawing, it's now going to complicate the situation. So avoid using drugs and alcohol. They may provide short-term relief, yeah, but in the long run or in the long term, it can make symptoms worse. Avoid drinks containing caffeine. You guys have said a bunch about it. Today, this column here was fire. You see why I love this place versus Facebook. Facebook right now, like you see the distraction. Look at all the valuable contributions in the comment section. Somebody come here after this live, they can comment in there. But if somebody click on this session, which will, if you have a live video versus if you post a video, it's 2 sessions, you can comment, you will see. You can read all these helpful tips that you guys share. That is the purpose of it. So we can all learn and grow together and stay healthy together. I want to be alive. I'm not scared of death. I keep telling you guys that. But I want to be alive and enjoy it at least whilst I'm alive. Yes, so let's go together. Let's make it happen. All right. Psychological therapies, self-guide help, cognitive behavior therapy, and we have more here. Medicine. Okay, let's try and see if we can get through this. This is an expensive one. Psychological therapist, if your symptoms do not respond to self-help techniques like those we just described, right, and lifestyle changes, your GP, which is your general practice in Europe, people will say that, or in US, your primary care physician, PCP, may suggest trying psychological therapy. If you prefer, you can refer yourself directly to a psychological therapist. For a psychological therapist, whatever they're saying there, you can refer yourself directly for psychological therapy, such as cognitive behavior therapy, without seeing a GP. Yeah, that's what I would say, because you already know you're having these symptoms. You know that the GP is not specialized to do therapy with you. So you do need to see a therapist. Guided self-help. We said a lot about that, but let's read this. With guided self-help, you work through a CBT-based workbook or computer course with the support of a therapist. The therapist works with you to understand your problems and make positive change in your life. So they work with you on the books. You have a workbook that's going to help you to realize that these fears are not realistic fears. And this is what alternative behaviors you can, coping things you can do to replace them, which we said a bunch of them here today. So CBT, you know what CBT is, so we're not going to read that. Applied relaxation is part of the things you can do, like the imaginary therapy, the relaxation therapy. You can do relaxation therapy in your bathtub, in your jacuzzi, or at the beach, like we've been discussing all along, in the medicine. So let's read this. As with CBT, a course of applied relaxation therapy consists of 12 to 15 weekly sessions. Yes, that is true. When I'm doing therapy with my clients, which I stopped doing, I don't like therapy. I like medication management. Therapy takes my time, and then a lot of notes to be writing. But like I said, if I'm doing concierge service, why not? So therapy lasts, for CBT therapy, it lasts for 12 weeks at least, or 12 to 15 weeks. I mean, it's a program. If you want to do exposure therapy, you have to be going there or doing the practice consistently, weekly practicing. And then the skills, when you come home, you come and be practicing the skills that you were taught by the therapist. But whilst you are with the therapy in the session, they also go through the exposure with you bit by bit. So you can't just go one day and then go to the place or go and be scared. You start talking about it. They start preparing your mind. They start helping you realize the reality versus the fiction, the fictitious concepts you have and the unrealistic concepts you have and the thoughts you have. So you start working through them. So the first day is never going to be. First day will be intake, second day will be a treatment plan meeting, then bit by bit, then after 15 weeks or so to help you. And by the time that time comes, you should be able to achieve your goal if you are determined to do the work. So if that don't work, if all that don't work, then you get to what medicine. Sometimes medicine can be used as a sole treatment for agoraphobia. In more severe cases, it can also be used in combination with CBT or applied relaxation therapy. I would say that medicine is helpful, but therapy is the best. But if it's debilitating, you need medicine. So you can go to work. And that's why I say take your propranolol, take your SSIR, take it few minutes before you head on to work so you can be able to cope better, right? That is it. Medicine, SSIR tools. But again, they have side effects, Sometimes people feel sick, like the person that took Theraflu, I think it's Miss Caroline or Miss Pauline, it's Miss Caroline, I think, and they having hallucination. Yes, these things, these SSIRs can make you have low sex drive, low decreased libido. blood patients. Some of them have specific, some of them have these side effects are high in some and not in others. So you just have to know what is your priority. Is it weight gain that is your concern in this treatment process with the medication, or is your sex drive that is important to you? Which one? So they will look at all that to decide on what treatment to give you. Sometimes you have diarrhea, sometimes you have constipation, feeling agitated and shaky. Definitely comes with a side effect of some medications. That's why you have to maintain the serum blood level. When you start taking the medication, don't just take yourself off it. You do, you're going to hurt yourself. You're going to either die from the negative effect of the withdrawal. You're going to either take your life as a result of suicidal thoughts, hallucination, and stuff like that. And so before you take yourself off any of these medications, you need to talk to your doctor. Don't just get up and take yourself off it. Okay, I think that YouTube is bringing out my mischievous side. That was fun though. That was fun and interesting. I feel like over here all the mature people came here and I love it. It was calmer here and we had a healthy conversation. Miss Caroline, that is fine. It was fun for me to read that. My mischievous brain. I'm right there with you. Kale, 1 green apple, cucumber, assorted berries, add lemon. Yes, you can add one lemon, half lemon, but that lemon does magic in that. Replace it, yes, daily or 3 to 4 times a week. Replace a meal with that. And you are on the right path to weight loss. That lemon does magic. Acknowledge your feelings and it will pass. Yes, have to acknowledge it. Don't ignore the feelings. If you don't acknowledge it, that I'm having panic, I'm having this symptom, how would you address it? How would you face it? How would you intervene? How would you cope? How would you implement your coping strategies that you are learning? Thank you for that, woman. You have to acknowledge the feelings. You have to acknowledge the panic attacks. You have to acknowledge that you're having them. Miss Linda Beckin said, I want to read about if you are on a plan and hit turbulence. It said not to force yourself to calm down. Don't stop the experience. Fight or flight example. Yes. So what she's saying, just like what's the name? Miss Oduma is saying, Miss Linda is enhancing that, is enforcing that. Acknowledge it. Don't fight it if you feel like you can't, allow yourself to have the panic attacks. Acknowledge that you're having them. And then think through it. What can I do now? That would be the most easiest. They said when we breathe fast, what happens? You lose what? It worsens the symptoms, the panic attacks. So deep, soft, slow, deep breaths. Breathe in. Release. You'll be surprised. Don't ignore the feelings. Acknowledge them. I love my psychotherapist. We spend time laughing at things that I used to take so seriously. Yes, when I tell you I take life so serious, so less serious, people don't understand. You can be so upset. I will render you so useless because I don't want to hold on, add your baggages to my life. Yes, that's a good therapist. A therapist you can gist with, a therapist you feel comfortable with, a therapist that you can sit on the lounge with, even have lunch with sometimes. I said I do concierge service, people. Those are some things that you can do. You have a concierge, a therapist that does concierge service. They can come to your house, they can meet you at you having social anxiety to public spaces, social anxiety and all that. They can meet you at the restaurant and have a meal with you. Just so they help you through the process of healing and overcoming that fear, unrealistic fear. I am learning to realign, to to lighten up. Yes. Yes, that's good. That's good, Miss Caroline. That's very good. You see, to understand, you see, she didn't die, did she? She's in therapy. Did she die? No. Did he kill her? No. I tell you that it's very normal. It's very normal. Maybe sometimes she can come and share with us how to lighten up. That's what she's working on. That's her goal. To not be moody, to feel cheerful, to not have her moods get the best of her. So she will stay lively and not depressed. See that she didn't die. It's actually, look at how much she shared. She made us lively here today in her comment. You see that it makes the day go by so easy. Being in therapy, it helps. Don't let anybody deceive you because of their ignorance and their biases. Grab any opportunity there is to be in therapy and learn something. Okay, that's so nice. That's so nice. Sharing too. So you see, those SSIRs, they can cause all these side effects. GABA painting, benzos, yeah. I will know. You know how I feel about benzo, right? GABA painting is a nerve pain. It's a nerve pain medication. If you are unable to take SSIRs or SNIRs for medical reasons, or you experience troublesome side effects like Miss Caroline is sharing with that thermoflu, some alternative for these drugs help with your agoraphobia and your anxiety is gabapentin. Gabapentin is an off-label drug used for treating like another medicine called gabapentin may be recommended. Dizziness and drowsiness are common side effects of gabapentin. Yay! Benzos, not good. Support groups, yes. You know, mommy loves support groups, right? Look at how much I had from you guys and how much we shared today. This is more than being a support group, people. I told you if you are on Empower Worldwide, we are in a court. We are leaning on each other to stay in this, to stay healthy. You understand? We are here and we're going to stay here together and stay healthy. Free of charge, people. Support with charities like Mind and Anxiety Care UK. Obviously, this article, I like this article. It's very extensive. Some of the things I didn't even read, but because I didn't think it's so relevant. It's very extensive. So obviously, it's written from UK. Are useful resources in America. Samsha is now a place that you can go and get anything on any topic, any help there, and then we have the crisis centers in your counties, in your states that you live in, 1-800 numbers that you can call on Samsha. You can do that. Then information, a lot of information and advice about how to manage anxiety and phobias. They can help put you in touch with other people who have had similar experiences. The support groups are awesome. So you end up having a support body that you all team up with to go. Okay. So one thing I will say here is like Facebook, we have stars over here. I don't know if I still have my membership where people can pay to support, but also the only way I can get any revenue, I think, is through the ads. So if you're coming on and you see the ads, if you do me a favor, don't skip them. Please don't skip them. I don't know if I still have my listing or not.
What do you want?
You see, if you somebody come later, they can see all your comments here. They can read from them and they can gain knowledge. Super chat. I think I don't have my super chat anymore. Yeah, I think I don't have my super chat anymore. But I don't know, because I'm not consistent here. I think YouTube took all my benefit away, but it's all good. When you come, leave a comment. Even when this video is finished, you can come and leave a comment there for me, because when this video is finished, the live chat will not be visible underneath it. And also leave a like, just like it. It doesn't cost you a dime to like it. Subscribe to the channel and turn on your notification. Henceforth, we're going to be consistent here with all our psychoeducation classes. Then when we finish right now, let's go and look at their faces on Facebook. How about that? We're going to do that right now. We're going to teach them how much fun. I enjoyed it today, honestly. I'd rather have the committed people who want to have a go, a change. Samsha, yes, Samsha, a go-to. Yes, Samsha is a go-to. Alcohol, anything mental health, world of information. Yes. Betrayal trauma. Great. You see, I keep right. Yes, betrayal trauma. That one we all been there, and we're gonna work through it. So that's one. You see, I got another topic, guys. I think this is the one I used to pick. So Miss. Oh yes, yes, yes. This is the show I was talking about. Do you guys see that? Quintia. Yes, somebody sent it to me. Obviously, I'm gonna see who it is, but yes, 40 grams Ghana. Use it for soya. You guys see the non-Americans and the non-Ghanaians or Africans. You see this herb? I'll share it on the Facebook page. This herb, oh man, it's so good. I don't know if you guys see. Unfortunately, with Facebook, I have lost also my, because I'm not consistent, people. I just came to love you guys and stayed with you guys on Facebook and pretty much almost abandoned. But all that is going to change. So if I had my community button back, just like I post on Facebook, here I can post that in the community community. So you could have seen that. So what I'm going to do is to share it to Facebook so that you guys will know. And I won't say much. I'll just say those who were on the on the channel for the psychoeducation, they know why I'm posting this picture. So just imagine anything with it. They should use their imaginary senses to think of what it could have been, what it could be, it could mean. Thank you so much for sending it, please. Oh, I need to say betrayal trauma. Yes, betrayal trauma is something that we all have um, dealt with, and that's a good topic to talk about. Yes, and some coping strategies and how to not let it get the best of us. These narcissists want to kill us. Ooh, we're not going to stay murdered by them. We're going to come out of it. The only way you can come out of it is to learn about it and learn some coping skills. Okay, I won't skip the ad. Thank you all so much. Yes, don't skip the ad. Let the ad play, and when they finish playing, then we come and let's learn together. Yes, I appreciate all of you very, very much. And let's go and look at their faces. Let's see what they want to talk about on Facebook. Here we can bring the drama here. I appreciate that all the serious ones are those who show that we didn't have to deal with any negativity. All right. Love you. Yeah, let me see if I can. share it. Yep, the least we can do to support is share it to your friends, to WhatsApp. You know, this place it will be very easy to share. Your friends to on WhatsApp, and then Facebook, your groups, and then yeah. Oh man. I can't even use this account to go on live on Facebook. They blocked me for 3 days because of all those people. But we move. I can use this account to go, so it's not a big deal. All my life you have been free. If I get my community tab back, it will be fun. I'll be posting there instead of Facebook. I mean, I will post on Facebook for sure, but those who are here will benefit more because they'll see that. But on YouTube, if you post any unhealthy comment, YouTube takes it out. They spam it. Unlike Facebook, everything goes. It's more of a. I feel like it's more of a professional platform and mature platform compared to Facebook. Yep. So thank you all. Let's go laugh on Facebook. Oh, Jenny. Oh, I started this already. They will hear me out. I said, let's go and laugh. They will hear me that I'm talking about them. Jenny, strawberries, raspberries, blackberries, and blueberries. Any of those is in a combination. Yes, that is assorted. Yes, it's been a great meeting. If you were not here from the beginning, you missed out. But yes, assorted berries. That's what Miss Linda said. There's a video on this YouTube channel that you'll find out. You know. So yep. I love you guys. You can join us on Facebook. Let's go laugh and go to bed.